Hello, everyone, and welcome to Munson Healthcare's virtual event, Minutes Matter, Understanding Stroke in 2021. We're here today because May is National Stroke Awareness Month. It was created to promote public awareness and reduce the incidence of stroke in the United States. And as the largest and leading healthcare system in Northern Michigan, we're excited to have you join us today to learn more about the different types of stroke, how to identify the signs and symptoms of a stroke, what to do if you are experiencing symptoms, learn more about the latest advancements in stroke care treatments and technology available at Munson Healthcare, and valuable information on preventive measures you can take to reduce your risk of having a stroke. We will have a Q&A session at the end of our presentation today. We encourage you to submit your questions through Facebook as they come to mind, and we will get to as many questions as possible in our allotted time. Next slide, please. So in addition to attending events like this, we encourage you to stay connected throughout the year with Munson Healthcare by signing up for our e-newsletter, following us on social media, or visiting our website at munsonhealthcare.org. Next slide, please. So I'm excited to be here today with one of our stroke experts who's doing just incredible work at Munson Healthcare along with the rest of the team, Dr. Kersti Bruining, who is a neurologist and the medical director of the stroke program at Munson Medical Center in Traverse City. And my name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I'll be your host and your moderator today. Next slide, please. So without further ado, I would like to welcome Dr. Kersti Bruining, neurologist and the medical director of the stroke program for Munson Healthcare, to share some valuable information with you. Dr. Bruining?
Thank you very much for that introduction, Diane, and thank you very much to Munson Healthcare for inviting me to speak on stroke during Stroke Awareness Month. Next slide, please. I'm very happy to talk to you today about stroke because it has such a big impact in the US. Stroke is the leading cause of death, is the 5th leading cause of death among adults in the US. And it's the leading cause of long-term disability. Every 40 seconds, someone has a stroke. And if you put that all together, about almost 800,000 Americans suffer a stroke each year. The very good news, though, is that 80% of strokes can be prevented, and we're going to get to that a little bit later in the talk. Next slide, please. A stroke is a sudden loss of blood supply to the brain. And of course, the blood carries oxygen and nutrients. And so when there's a lack of blood supply, there's a lack of oxygen, nutrients to the brain, and therefore brain damage occurs. The brain, it's helpful to understand stroke to understand that the brain is made up of cells called neurons. And I have a drawing here of a neuron so you can see what it looks like. Next slide. The brain is made up of different parts, and the part called the forebrain is the most highly developed part of the human brain, and it's much more developed than all other creatures. The forebrain is where we do our thinking and our decision making. The forebrain is where our personality is housed, and really the forebrain is what makes each of us who we are. The human forebrain has 22 billion neurons, but for every 1 minute of lack of blood supply, we lose 1.5 million neurons. So almost 2 million neurons per 1 minute of lack of blood supply. Another way to think about that is if there's lack of blood supply or insufficient blood supply for an hour, that's approximately the same as 3.6 years of normal aging. So it's really impactful. Next slide, please. There are 2 kinds of strokes. There are bleeding strokes and blockage strokes. Most strokes are blockage strokes, which we call ischemic. A blockage stroke makes up 87% of all strokes. And that's when the blood flow to the brain, that's when the blood flow to the brain is blocked. And that can happen for 2 different reasons. It can happen because of a thrombus or an embolus. A thrombus is an area of the blood vessel that has become narrower and narrower and narrower. And finally, that very narrow area develops a little blood clot in it and stops the blood from continuing to flow onto the brain. And then the part of the brain where that blood would have gone cannot survive. The other kind of blockage stroke is called an embolus. And an embolus is a small particle that started out someplace else and then floats upstream until it gets stuck in the littlest blood vessel it can reach. The other kind of strokes are bleeding strokes. We call those hemorrhagic. So that's the remaining 13% of strokes. And that happens when a blood vessel inside the brain bursts. So once again, with a broken blood vessel, the blood cannot get to where it needs to in the brain. And also there's additional damage because of blood being other places. Next slide, please. This picture shows an example of a thrombus stroke. This is the carotid artery, and there's a very large degree of fatty accumulation and something we call plaque in the carotid artery, so that it has become very narrow on the picture on the right side there. And then finally that closes off, and the blue color and the top part of the picture shows where blood is not reaching. Next slide, please. This drawing shows a picture of the embolic or embolus type of stroke where a particle floats upstream. This is a very common cause of strokes that are from a particle. There's a condition of the heart called atrial fibrillation, which can allow blood clots to develop in the heart, and they then can escape the heart and travel upstream into the brain and get stuck on a little blood vessel. Next slide, please. You may have heard the term TIA along the way. That stands for Transient Ischemic Attack. What a transient ischemic attack is a temporary loss of blood supply to the brain. So it's exactly the same thing as a stroke, except it's temporary or transient. It generally lasts less than 5 minutes. These are painless, and sometimes they're not even all that noticeable. A person might sort of disregard it or say, oh, you know, this is an odd thing that's happening. I'll just see if it gets better. I'll go lie down, I'll rest. But unfortunately, these are very important warnings of a stroke, and actually it should be considered a major emergency. So the good news is that the blockage happened and then it cleared up, but whatever caused the blockage could potentially happen again. And we know that because statistically, if a person has a TIA, they're 9.5 times more likely to have a stroke than somebody who's never had a TIA. So it's really important to pay attention to these symptoms and then to learn about what those symptoms might be. And one way to remember what the symptoms are to remember, be fast. So when a stroke happens, something is new or something's wrong, and it happens suddenly. It doesn't sneak up over several hours or a day. It's boom, right away. And when something happens quickly, you can think through this term, be fast. B stands for balance. Has the person suddenly lost balance? E is for eyes. Has the person lost vision, or are they having double vision? F is for face. Is the person's face drooping, or is it uneven one side to the other? A stands for arms. Does it look like one of the arms is not working well, or there's weakness on one side? And actually that applies to the legs too. You can ask a person to hold their arms up in the air, and if one of them tends to drift down, that would be an easy way to check that. S stands for speech. Is the speech slurred or strained, or does a person seem to be able to not understand what you're saying to them? And then T stands for time. It's time to call 911. Next slide, please. The reason it's important to call 911 is because of what we talked about, that we lose about 2 million neurons per minute. So really every single minute counts. If you think somebody's having a sudden change with balance, eyes, face, arm, or speech, then you call 911 and you take a look at a clock and see what time did this start. And it also makes sense to think about what time did you last see the person totally normal? The reason it's important to call EMS, so when something like this happens, there could be a thought that, let me see if it gets better. Not a good idea. Another thought could be, I don't live very far from the hospital. Let me just drive this person there. That's also not a good idea, because when you call 911, emergency medical services will come to the location, the EMS team. And the EMS team actually begins the evaluation right when they arrive. So the EMS team can do things that you can't do very easily unless you're an EMT. What they can do is they check vital signs. They are trained to do a skilled examination to look for signs of stroke or signs of other things that might be like a stroke. They can do some blood testing. And very importantly, they're in touch with the emergency department and alert the emergency department that they're on their way, so that the emergency department team can be waiting and at the ready for this person to arrive. If a person is driven to the emergency department, then there has to be parking, there has to be walking in or with a wheelchair, there has to be a conversation about what the trouble is, and there are inevitable slowdowns that happen that are avoidable if you call 911. Next slide, please.
Dr. Bruining, before we move on to the next slide, if we could just stay on that slide for just a question I have. I just want to make sure I'm clear. So even if I think it's a TIA and it kind of clears up, as you mentioned, you're still recommending that no matter what, call 911?
Yes. The reason for that is, as I mentioned, people are almost 10 times more likely to have a stroke. And if they do have a stroke, they're statistically most likely to have it within the first 24 to 48 hours of their TIA.
Okay, so that's really great to know. Thank you for that. And one other question, you mentioned the BFAST signs and symptoms. Is it the thought that the stroke could be more severe if someone has multiple symptoms, or what if someone only has one of those symptoms? So I'm thinking if you even just have one, you should still call 911.
Yes, I would say if you only have one, still call 911.
Okay. In
general, if there are more problems, more symptoms generally tend to mean that it's going to be a more problematic stroke, or could potentially leave the person with more challenges. But even one symptom can be life-changing.
Okay, thank you. I'll let you move on.
Okay, next slide, please. So once the EMS team brings the person to the emergency department is ready to move very quickly. And the evaluation continues, looking for signs of stroke and looking for signs of other things that could be like a stroke or a stroke mimic. One of the most important tests that's done early when a person arrives to the emergency department is a CAT scan, also called a CT scan sometimes. That looks for, again, other causes of stroke. And if it looks like it is a stroke, then the CAT scan determines whether it's a bleeding stroke or a blockage stroke. The treatments that are done for a bleeding stroke are very different than the treatments for a blockage stroke. So it's critical to figure out to determine which of those it is. And there isn't any other way to know, only by taking a picture. Then once the CAT scan's done, and while the CAT scan's done simultaneously, treatment options are being considered. And the goal of the treatments are to limit the amount of brain injury and even to reverse the stroke. So once again, the sooner the treatment is started, the fewer minutes go by of lack of blood supply, the better the chance of a good recovery. Next slide, please. For blockage strokes, the goal is to unblock the blood vessel that's been closed off, and to hopefully actually return the blood flow, and not only limit how big the stroke is, but to actually reverse the stroke. And that can be done. There are two ways of accomplishing that. One is with a clot busting medication that's called TPA, or also sometimes called Alteplase. This is an intravenous medication that's given once the CAT scan's done and it's determined that it's a blockage stroke. The medication dissolves the clot and allows the blood to move back into the blood vessel. The other way of restoring the blocked blood supply is by manually opening up the blocked blood vessel. And to do that, a specialized team is needed. We call it a specialized endovascular team. That team goes into the blood vessel with in a minimally invasive procedure using a very thin wire called a catheter. And that wire and little tubing can be used to capture the clot or the particle and remove it and actually pull it out. Sometimes with the same catheter, it's necessary to hold the blood vessel open if it's narrowed in such a way that it just won't stay open, and something called a stent is put in there. Next slide, please. If the CAT scan shows that it's been a bleeding stroke, then the goal is to limit the bleeding, limit the source of bleeding, and then also to try to limit the other brain injury that's happening because the blood is where it doesn't belong. A specialized endovascular stroke team is also needed to help with that. And then other teams of doctors and providers and nurses also play a role in this kind of stroke. The minimally invasive procedure can also be done for these kinds of strokes, the bleeding strokes, and sometimes an operation where the skull is actually needed to be opened up with neurosurgery is also necessary. Next slide, please. Within the last year, Munson Healthcare has put into place a specialized endovascular stroke team, and the leader of that team is Dr. Gary Raja, whose picture you can see here. And I'm going to let Dr. Raja introduce himself and introduce some of our new equipment on the next short video. Next slide, please.
My name is Dr. Gary Raja. I'm a Michigander by birth and did most of my training down in Grand Rapids and Detroit. I did a neurosurgery residency at Wayne State, Detroit Medical Center, and then I did a interventional and neurovascular fellowship at Buffalo, the Canon Toshiba Stroke Center in Western New York. I'm excited today to tell you I've joined Munson Healthcare back in June. It was my first time here, and since that time we've been very busy. It's across northern Michigan, again in a way that hasn't been done here prior in northern Michigan. We're now able to bring patients into northern Michigan, Traverse City, and do interventional stroke procedures, allowing them to have their lives back. We're truly excited about this, and we'd love to show you the lab and all that we've been doing here at Munson Healthcare. So if you come with me, I'll show you the lab here. This is what we call the interventional suite. This is a new state-of-the-art biplane machine, which was just recently acquired. We've been using it roughly 1 week now in clinical use. This machine is called the Artis Icono. It has 2 X-ray cameras, one here and one here, and the patient would lie on the table. We're able to, in real time, with the patient awake, look at catheters that are going from either the wrist or the leg up into the brain, and able to locate clots and pull them out carefully, all while the patient's awake. Sometimes we'll even see our patients that came in with weakness on one side of the body or the other, or speech issues, improve right on the table during these procedures. This machine is one of 7 in the United States. It was only recently approved for use in the United States and is truly state-of-the-art.
This is very good news that we have new treatments available in northern Michigan to help reverse strokes. And I wanted to tell you the very good news also that 80% of strokes can be prevented by healthy behaviors. I also want to make one clarification on the video. In the video, Dr. Raja said that the equipment that he was showing has been there for 1 week. This was filmed several weeks ago, so it's been in use now, and we've taken care of quite a few patients already with that, with really good success. And we're thrilled that Dr. Raja is here with us now, and the entire team works together to do that procedure. So now on to what, talking about how we can avoid meeting Dr. Raja. The healthy behaviors prevent 80% of strokes. And we all know what they are, but I'd like to go through them one by one because these really can make a big difference. These include managing high blood pressure, healthful eating, controlling cholesterol, managing blood sugar, losing excess weight, physical activity, avoiding tobacco and unhealthy alcohol use, and avoiding getting COVID-19. The lucky thing is that many of these things are all help each other. So I'd like to talk first about high blood pressure, because high blood pressure really, of all of the stroke risk factors, if there's any one that can have the very biggest impact on reducing stroke risk, it's to control high blood pressure. High blood pressure is the most powerful risk factor for stroke. So high blood pressure is very common. Half of Americans have high blood pressure, and unfortunately, just a little under half actually have adequately treated high blood pressure. The one nice thing is that there are many lifestyle factors that have a really big impact on controlling blood pressure. And these same lifestyle factors or healthy behaviors that lower blood pressure are also good for stroke otherwise. And they're also good things to reduce stroke risk in people who don't have high blood pressure. Next slide, please. One very important way of helping to reduce high blood pressure with lifestyle or healthy behavior choices is by limiting sodium. So sodium is salt. We all like the way salty things taste, and it turns out that saltiness, enjoying saltiness, is a bit of a learned behavior, and it turns out that Americans eat on average 3,400 milligrams of sodium each day. Now, the American Heart Association recommends not more than 1,500 milligrams of sodium. And it looks like the part of that slide is cut off a little bit, but the recommendation is 1,500 milligrams. And to have an understanding of what that is, 1 teaspoon of table salt has 1,300 milligrams. So, you know, a little bit more than half a teaspoon a day is what the recommendation is for people who have high blood pressure and for most everybody. The easiest way to start with that is to not add additional salt at the table. Other ways to accomplish that is to read labels. So lots of prepared foods have quite a lot of sodium in them. And when you have these numbers in your head, sort of trying to aim for not more than 1,500, you can add up what you're taking in and have a sense of that. Next slide, please. Another thing that helps reduce stroke risk is to have healthful food choices. And the same healthful food choices tend to also help other parts of other ways, to help promote other ways of reducing stroke risk. So healthy food choices would be those that are rich, a diet that's rich in fruits, vegetables, and whole grains. And then proteins would be mostly limited to fish, poultry, and seeds and nuts. So not so much of the red meat. Dairy is best to stick with low fat or non-fat dairy. And then limiting sugary foods in general helps to meet these goals. Achieving a healthy weight and maintaining it reduces stroke risk, as does diabetes, controlling diabetes for those who have diabetes. Next slide. Regular physical activity, a sedentary lifestyle is a stroke risk factor. So having regular physical activity reverses that. And regular physical activity also helps to control blood pressure and helps to control weight. And so these all help each other, all these different things. The physical activity that's recommended by the American Stroke Association and American Heart Association is to do aerobic activity, meaning where your heart has to beat a little fast and you have to breathe a little bit hard, to do that 5 times a week at a moderate level. So moderate level would be something like walking for 30 minutes, where you can have a conversation. You have to maybe work a little bit at it. So 30 minutes of that 5 times a week is the recommendation. Or for those who prefer something more vigorous, like running or another more vigorous exercise, 3 times a week would be the recommendation. It's also wise to do some strengthening and endurance exercises twice a week. Tobacco is not good for the blood vessels. What tobacco does is it irritates the inside lining of the blood vessels, and it causes them to become narrow, and it makes them so the irritation makes it easier for blood clots to develop on them and for fatty deposits to build up. And so tobacco in any form is not good for the blood vessels of the brain or other parts of the body. And so avoiding tobacco in all of its forms is a recommendation. So that would be smoking, chewing, and vaping. Excess alcohol also is a stroke risk factor. So the recommendation is for women to limit their alcohol intake to not more than 1 drink a day, or an average of 7 per week. And for men, not more than one to 2 drinks a day, or 14 per week. So a drink would be 1 12-ounce beer, or 1 5-ounce glass of wine, or 1.5 shots or a jigger of hard liquor. Binge drinking also, so people who don't drink very much but then have a large quantity at once in a binge puts them at increased risk of stroke as well. And there are pretty solid statistics that show that overuse does increase the risk of stroke, both the blockage kind and the bleeding kind. Medication, if a person has been prescribed medications, either to help prevent stroke or for high blood pressure or diabetes, then of course taking those properly helps to keep all of those things in check. Next slide, please. COVID-19, we've all heard probably more than we ever wanted to about it, but unfortunately COVID-19 is also a stroke risk factor. Why that's the case is not fully known, but we know some things about it. One thing we know is that any kind of infection or inflammation in the body makes the possibility of a stroke higher. So that inflammation response is somehow irritating to the blood vessels overall. So just having an infection promotes stroke. And then COVID-19 all by itself promotes promotes clotting. So people can have clots more easily where they otherwise would not have one, and then have a stroke because of that. It's quite possible there are other factors caused by COVID-19 that haven't been worked out yet, but of course there's a great deal of research going on to try to understand that. Worldwide, COVID-19 causes strokes, the blockage type of strokes, in between 0.4 and 2.7% of people. And the bleeding type of strokes happen as well, but less, a little bit less than 1%. You can see the statistics there, 0.2 to 0.9% of people with COVID have bleeding strokes. Here at Munson Medical Center, we looked at our statistics starting from, well, all of 2020. So that would really be from March on when we started being aware of COVID-19 until February of 2021. And of all of those patients, 2% of all the patients that we took care of here at Munson Medical Center who had stroke also had COVID-19. Or if you look at it the other way, the reverse direction, then 1.7% of all the patients with COVID that we took care of here in the hospital also had a stroke. So that 1.7 is approximately what the same statistic has been seen around the world, and would and so is same as other people around the planet have experienced. So I call COVID a stroke risk factor as well, and then avoiding getting COVID by washing hands, wearing masks, etc., and avoiding COVID by getting the vaccine reduces that risk factor. Next slide, please. So in conclusion, stroke, as I talked about, is a brain injury because of blood vessel blockage or bleeding. And the bottom line is that the blood does not get to the part of the brain that needs to get to. When a stroke is suspected, remember, be fast, brain, eyes, face, arm, speech, and time to call 911. Immediate treatments, very quick treatments can prevent worsening of the stroke and also can actually reverse the stroke and help make it much more likely that a person can return to their normal function. 80% of strokes are preventable by lifestyle choices that we can control. And then finally, receiving the vaccination to prevent COVID helps reduce the risk of stroke from COVID. So thank you very much. Oh, I'd like to add, on the Munson website, there is a stroke risk assessment tool. So when you look at the website in the stroke area of the website, there is this tool, which is an interactive tool online to assess your stroke risk. And then when you can determine where you land on this, you can design a program for yourself to how to help reduce your risk.
Thank you so much, Dr. Bruining. That was really great information and very informative. We are going to enter into our Q&A session now, so appreciate you being able to stick around and answer some questions that we're actually receiving quite a few questions from our viewers, which is great. That means that people are interested in this information, and hopefully we can get to all these questions. So the first one is, can hitting your head cause a stroke?
No, hitting your head cannot cause a stroke. Hitting your head really hard, a really bad head injury, can cause brain damage, but it would be from the actual impact against the brain, and it would not be from a blocked blood vessel or a burst blood.
Okay.
A burst blood vessel.
Good question then. And is a, we hear the term aneurysm a lot as well, and we think of that as a burst or a blood vessel that's burst or something. Is that the same thing as a stroke?
An aneurysm, what an aneurysm is so the short answer is yes.
Okay.
The long answer is that an aneurysm is, there are a couple different types of aneurysms, but the most common type is where part of the blood vessel is a little bit thin. Usually a person is born with an area that's just a little bit thinner than other areas. It's usually at the branch point of a blood vessel. And, and then over many years, especially if a person has high blood pressure, the normal pulsing of the blood starts to push against that slightly thinned area so that it balloons out. And if it balloons out enough, it can burst, and that would cause the bleeding type of a stroke. So that is a cause of stroke. The things that can reduce the chances that would happen are to keep blood pressure under really good control, and also to not smoke.
Okay, great. Thank you for that clarification. And that's a great segue into our next question, which is, what is considered high blood pressure?
There's a little bit of, this has been debated over many years. A pretty strict cutoff would be 140/90. So the top number 140, bottom number 90. There are also recommendations on the part of the American Stroke Association that the lower the better, unless some people have abnormally too low blood pressure. That's not good, but generally to keep it as low as possible. There are some groups of people who need to have blood pressure a little bit higher than that to be at their best health. My best suggestion would be to work with a person's primary care provider and learn what is really the best blood pressure for that individual. But 140/90 is agreed upon, that certainly not higher than that for most people.
Great, thank you. And then the next question is, can someone have a stroke and not realize it?
Yes, and it turns out that there's a part of the brain that's designed to recognize things like the fact that I'm having a stroke. And if the stroke happens in that part of the brain, then a person won't recognize it.
Oh, it's fascinating.
They won't know. It'll take another person to realize it.
So someone else will have to see you exhibiting one of these symptoms in order to really get you to treatment and call 911. So we should all be on the lookout for that, correct?
That's right. There's also one type in the speech, in the B fast, the S for speech. People commonly think of strained speech or that where it's slurred, it's hard to understand. But there's another variation on that where a person might sound like they're talking normally, but they have no idea what you're saying to them. They cannot understand. You ask them questions, ask them to do something, and they can talk, but they cannot. What they tell you doesn't make sense.
Okay.
And that's also a type of stroke that's with speech, and a person is likely to not recognize that they're having that problem.
Fascinating. Okay, thank you for that information. The next question is there a way to determine if you are genetically at higher risk of a stroke?
When there is, there are some very uncommon types of situations that can cause a person to have blood clotting more easily than others, and there are some genetic blood tests to look for those. If people generally have problems with blood, with their blood vessels being unhealthy, such as having heart disease from narrowed blood vessels, then they tend to be at risk also for stroke. And those kinds of things do run in families, although it's very, we cannot escape our genes, our genetics. We cannot choose our parents, but we can choose how we spend our the time that we're given, and it's possible to really alter the destiny of somebody who's got a genetic tendency to have stroke with healthy behaviors. And if a person does have one of these uncommon genetic situations where their blood clots too easily, there are some treatments for that as well.
Wow, that statement just really hit home with me because both of my parents have had strokes. So I better watch what I'm doing here. So let's see. The next question is, are there any side effects to the clot medication, or is that better usually than the manual or the intervention to, treat a stroke?
The clot busting medication must be used very quickly. So there's so I want to answer that question with just reiterating that every single minute counts. There's 2 million neurons a minute. We don't want to lose either way. Having said that, the clot busting medicine we know works really only within the first 4.5 hours of the onset of a stroke. So a stroke starts and you have about 4 hours to figure out if that's the right thing. And then there's some testing, et cetera, involved with making sure it's the right choice to use that clot busting medicine. And after that, the research has not shown that it'll work after that, and there could be some risk of bleeding. So the main risk of that clot busting medication is that it thins the blood or breaks up clots, and it can actually cause bleeding as a side effect. And the bleeding could happen anywhere in the body, including in the brain. The risk of bleeding in the brain, when this medicine was first designed way back more than 25 years ago now, it's been used for more than 25 years. It was, in the research, it was about 6% of people who received that had some bleeding in the brain. Now we have lots of experience over these last 25 years. It's used very carefully and cautiously. And our statistics here at Munson are that the bleeding rate is much lower than that. And it does help a lot. It helps increase the chances that a person can return to normal. Now, the mechanical clot removal doesn't have that same bleeding risk. There are other risks. Whenever any kind of procedure is done where you insert something into the body, there's always some risk to that, and it's not free of risk. But the bleeding risk is pretty minimal with that, or low with that procedure. There's some these things are new, and we're learning all the time. As of now, as of the most up-to-date information that we have, unless a person is at the right, practically in the ER when they have their stroke, it still is considered to be most beneficial to get the clot buster if there's not a reason to not give it, to receive that clot busting medication and then go on to remove the clot.
Great answer. Okay, thank you. That was really helpful. So this next question, I'm going to ask it exactly as written, just like I've been doing, because I don't know exactly what this means, but it says, how long does it take to recover from a TBI stroke?
I think the person who wrote the question, please clarify if I'm wrong, but by TBI, do you mean traumatic brain injury?
Oh, I didn't know what that acronym meant. That could be. Why don't you go ahead and answer the question in that regard, and then have the person they'll let us know if we didn't answer the right question.
Okay. The very first question that you asked me was, can you get a stroke from hitting your head? And I said no. So to return to this traumatic brain injury, if somebody hits their head really very hard, it can cause bruising in the brain or bleeding in the brain. Same as if you hit your arm really hard or your leg really hard, you could get some bruising and bleeding, and that would cause brain damage also. Strictly speaking, that's not exactly the same as a stroke, because it's not a blocked blood vessel or a damaged blood vessel that opened up. It was damaged and it did open up because it was hit, or it was, something banged against it. So I can understand that might be called a stroke, but it's not strictly the same thing. The second part of the question was, how long does it take to recover? And that depends where the injury was and how extensive it was, and very often how old the person is. Young children and younger people tend to recover from things like that a little bit more easily than older people. So I'm not able to answer the question precisely, but those are the general ideas.
Great, thank you. All right, the next question is, and I think this is a fascinating question because I know I've had relatives who have gone in for a routine checkup or something, and their doctor has said, oh, when did you have your heart attack? And they didn't even know they had a heart attack. So the question is there a way to test if you or a loved one has had a TIA weeks or years ago? Is there a time limit on how far back this can be tested?
A TIA is, as we talked about, it's a transient or temporary blockage. So there used to be, a TIA used to be said to be something that has lasted for 24 hours or less. That definition changed, and you may well have heard this somewhere along the way, because that definition was used for decades. But now with our more advanced equipment and MRIs, the definition that's used by the medical community has changed, so that a TIA is something where there's been a temporary blockage of blood supply and some symptoms, but it didn't cause any damage. In other words, it doesn't leave any after effect on the person, and it doesn't leave any mark on a test called an MRI of the brain. So a TIA really, you can't, the way to make a diagnosis of a TIA is through what the person experienced. What did they feel? What was happening when, if it's possible to examine them at the time, and then they return to normal, and their MRI doesn't have any mark on it. So it is possible to see if a person, sometimes people have strokes that last a very short amount of time. They get better really quickly, but they do leave a mark on the MRI. So they really were a real stroke, and it really did cause injury to the brain. And those we can see on an MRI test, or sometimes on a different CAT scan, or examining the person. So it is possible to see if a person's had a stroke in the past that got better, but it is not possible with any kind of a test other than a conversation with a knowledgeable provider to know if a person has, to prove that a person's had a TIA.
Great, thank you. That's really interesting information. I did not know that, so thank you. All right, our next question is, a family member had a catastrophic hemorrhagic stroke. He is paralyzed on the right side and has expressive aphasia. What is his risk of second stroke and why?
The risk of the second stroke probably depends upon what his risk was of the first stroke. But if he had the risks that we talked about trying to prevent, high blood pressure, diabetes, perhaps issues that we can't actively prevent, like atrial fibrillation. I mentioned that when we talked about the particle strokes. If a person has those risk factors, then their risk is higher than somebody who's not had a stroke before. And I'm sorry that I'm not able to give you an exact statistic, but the purpose for having a person come to the hospital when they have a stroke, well, one purpose is to try to reverse the stroke if they can arrive quickly enough. And then the second very important part of the whole stroke team that we have here at Munson is to review all of those factors and try to make them all as much better as possible. So to look for for diabetes, to look for high blood pressure that's not under the best control, to talk about stopping smoking, and to really optimize or make as good as possible all of these preventable, or all these factors that can prevent the next stroke. So that's the whole point.
So that is good news then, that a second stroke could possibly be prevented. That's correct.
Got it. Certainly a second stroke can be prevented.
Yeah, so I think, you know, we obviously can't give specific medical advice on these events, but I do think it would be just a good thing if, you know, talk to your doctor, understand, you know, work with your doctor on your specific risk factors and see what you can do to make some positive changes and to mitigate that. Thanks, Dr. Bruining. The next question is, you mentioned the capability of the endovascular stroke team at Munson Medical Center in Traverse City. You also mentioned, you know, that if you have any of the BFAST symptoms, call 911. How does that work if someone lives outside of Traverse City? And, you know, are they going to be taken to the emergency department at another hospital and then transferred to the medical center? Or, you know, how does that stroke network kind of work? And how do you work with the EMS teams to make sure that they get to the right level of care?
The person who's having the symptoms of stroke goes to the nearest hospital, and all of the hospitals within the Munson healthcare system are able to diagnose what looks like a stroke, and then they are so all of them are able to do a CAT scan, and they're all able to also do some more advanced CAT scan testing to look for a possible blockage that might be able to be removed with the by the endovascular team. And then the emergency department providers in the center that's outside of Traverse City call Munson, and they speak to the doctors here, and that would be any number of the folks on the stroke team. Also, the pictures are able to be sent over to us. We're able to see most of them right away, and in the very near future, we'll be able to see them even more quickly, but we can see them, we can make recommendations, and the treatment, if it's going to be a clot-busting medicine, the treatment is then started there at the other hospital, and the patient is brought over to us by ambulance or air.
So that's really great news. So you don't have to think that you're going to be in an ambulance for an hour or an hour and a half to try to get to the medical center before you seek treatment. So that's great. That's great news. Another question, and I think this is one we anticipated, I'm going to ask it, is this person says, I don't use tobacco, but I use cannabis. Is this a risk factor as well? Because you mentioned smoking as a risk factor.
It's not as clear. It's not as clear what cannabis is, what kind of effect cannabis has on stroke risk as it is with tobacco. That the tobacco has been very clear for a long time. The main reason why it's not clear with cannabis is that really good research has been very hard to do with cannabis because it's been illegal until now, so until recently. So it was not possible to do trials where a person would be, some of the participants in the trial would use cannabis, some wouldn't, and then you check results, how many people had stroke, several years later. So that has not been possible. There's some thinking that it may be somewhat of a risk factor, but I am not, but the data is not clear enough for me to make a strong statement about it.
Yeah, we appreciate the question too, because I think it's a common question that we anticipated, and we will do our best to keep our patients and our community informed as we learn more, because as you mentioned, it's new and evolving as always. So that was our last question. So I'm really impressed that we got through all of the questions that were coming in from the live streaming event. So I just want to thank you, Dr. Bruining, so much for joining us and for all the incredible work that you and the stroke teams and the endovascular teams and everyone at Munson Healthcare is doing to advance stroke care in Northern Michigan. And I know that in looking at expanding the program last year, we know that where services are available, the outcomes are better, and more people end up surviving and getting back to their lives. So that's just really great advancements here in Northern Michigan. So thank you, Dr. Bruining. And just lastly, I just want to remind everyone that you can stay in touch with Munson Healthcare in a variety of ways. Look for another invite to one of these types of events on new advancements and topics of interest. Also, please sign up for our e-newsletter, follow us on social media, visit us at munsonhealthcare.org, or I also want to mention that we have an Ask a Nurse hotline that you can call. Many of the questions that we had today were related to specific individual risk factors, or that if you don't have a primary care physician or you can't get a hold of your primary care physician and you have a question, our nurses are ready and waiting to answer your calls. And you can call 231-935-0951. And that's not, I know we've been promoting that a lot as a COVID-19 resource in the community, but it is much more than that. So feel free to ask questions about stroke or diabetes or any of those kinds of questions as well. So again, Dr. Bruining, thank you so much for this information. Looking forward to having another event like this in the future, and everyone have a great day.
Thank you.